Welcome to The Explainer. Imagine spending your entire life studying the human body, knowing every intricate detail, only to develop a terrifying blind spot when it comes to your own health. Today, we're diving into an absolutely wild medical mystery featuring a famous doctor who literally missed the most critical warning signs of her entire life just because she was too busy to notice.
Okay, let's dive into this. The doctor we're talking about is none other than Dr. Sandra Lee, who you probably know as TV's Dr. Pimple Popper. She's this incredibly successful dermatologist and surgeon, right? But one night, she experienced a massive, life-threatening medical emergency, and she totally dismissed the symptoms. She basically chalked up these huge physiological red flags to just being exhausted from filming her reality show. It really goes to show that even the most highly trained medical professionals out there are definitely not immune to putting their health last.
Section 1. Dismissing the early signs.
I want to walk you through this timeline pretty fast because it really mirrors the escalating physical panic of that day. So, daytime, she's on set, gets this unusual hot flash. Then, at dinner, a super strange symptom hits. She actually has trouble swallowing her soup. By nighttime, she's feeling these shooting nerve pains down her legs. And finally, late at night, she tries to get up and is just stumbling around with this profound weakness on her left side. This is that expert's blind spot in action. It's crazy how easily she brushed off every single one of these escalating symptoms. She just told herself she was crabby, stressed out, and exhausted from a long day. She just wanted to hit the pillow and be ready for her patients the next morning.
But wow, things really took a turn in the middle of the night. While she was stumbling in the dark with that left side weakness, her medical training actually did kick in for a split second. She performed a classic medical school neurology test on herself right there in the pitch black. She held both of her arms out in front of her, and as she put it, I just see one hand sort of crumble. I mean, just imagine the sheer terror of watching your own body fail a basic neurological exam. She also noticed she was stumbling over her words, totally slurring, and yet, unbelievably, she convinced herself it was just a panic attack and went right back to sleep.
Section 2. A shocking ER diagnosis.
Now, what's really interesting here is the sheer gravity of what was going on inside her body while she was trying to push through. The very next morning, she still wanted to go to work. She only stopped because her parents, who are also in the medical field, practically begged her to go to the ER. The second she arrived and described her symptoms, they rushed her right in. And the diagnosis? An ischemic stroke. The Mayo Clinic defines this as when part of the blood supply to the brain is blocked, reduced, or leaks out, causing brain cells to die incredibly fast. So for Dr. Lee, hearing that she just had a stroke at 55, total, absolute shock.
But here's the thing. While she was totally blindsided, a quick look at her medical history kind of reveals a different story. She actually had a handful of pre-existing risk factors. She was 55, she had high blood pressure, she had high cholesterol, and she even had a family history of strokes, as her dad had actually suffered a mini-stroke before. So this is a massive takeaway for all of us. Managing those underlying issues like your blood pressure and cholesterol early on is absolutely vital. You've got to take care of those invisible numbers today so you don't face a catastrophic event tomorrow.
Section 3. Recognizing the Be Fast symptoms.
So the crucial point is this acronym, Be Fast. Honestly, everyone watching this explainer needs to lock this into their memory right now. Let's break it down. B is for balance issues or unsteadiness. E is for eyes, meaning sudden vision changes. F is for facial weakness or drooping. A is for arm or leg weakness, exactly like Dr. Lee's crumbling hand. S is for slurred speech, which she also had. And finally, T stands for time. This means you call 911 immediately to get treatment as fast as humanly possible. Dr. Lee had almost all of these, but she completely ignored the T. She didn't make the call.
And that brings us to the massive number 4. So why is this so critical? Well, 4 represents the critical 4-hour treatment window for an ischemic stroke. If you can get to a hospital and get treated within those 4 hours, you have a really good chance to avoid long-term, permanent effects. But because Dr. Lee tried to tough it out and literally sleep it off, she tragically missed that window. And honestly, that one decision completely changed her life.
Section 4. Navigating the new normal. And this brilliantly illustrates the heartbreaking contrast she has to live with every single day. On the one side, you have her core identity, right? A precise surgeon whose entire livelihood relies on having a perfectly steady grip. On the other side is her current reality. Sure, on the outside, she might look completely fine to everyone else, but on the inside, she's constantly struggling with changes in her grip. Plus, whenever she gets overworked, nervous, or tired, she still deals with frustrating speech difficulties. Losing that absolute, rock-solid confidence in her hands has been incredibly tough. striking right at the very heart of who she is as a professional.
But, she is absolutely not giving up. Her path forward involves 3 really strict steps. First, she's taking low doses of blood pressure and cholesterol meds to manage those risk factors. Second, she's doing dedicated physical therapy. And third, occupational therapy. She is taking such an active role in her recovery. She explains it like this. The muscles are still there, but she has to go through this grueling daily process of retraining her brain to find new pathways to talk to those muscles. It just shows that recovery isn't some passive thing. It is a relentless, everyday commitment.
Section 5. A change in perspective.
Before the stroke, she admitted she never really even thought about getting older. She just figured it would happen when it happened. But surviving a stroke at 55 completely flipped her priorities. It made her realize that if she wants to be around to see her grandkids, she has to actively take care of herself right now. And she also brought up something really interesting, a deep cultural pressure that actually played a part in her ignoring the symptoms. She talked about the pressure to hide weakness, specifically mentioning the stigma in the Asian community around showing vulnerability. That cultural pressure, stacked on top of her incredibly busy life, created this perfect storm where asking for help just felt like a failure.
So now she's using her massive platform to issue a warning, and it's captured perfectly right here. Too many of us try to simply tough out health problems. I tried to sleep on it. Even as a highly trained doctor, she fell into that classic trap of feeling young, feeling totally invincible, and thinking, there is no way this is happening to me. Her heartfelt plea to all of us is so simple. Do not repeat her mistake. Please, never try to sleep off a serious symptom.
So, we're going to end this explainer with a direct question for you. If your body sent you a warning sign tonight, like a sudden weakness, maybe stumbling over your words, or just totally losing your balance, would you listen, or would you try to sleep on it? Memorize that Be Fast acronym. Manage your health early, and remember, when it comes to a stroke, time is the one thing you can never, ever get back. Thanks so much for learning with us today. Keep asking questions, keep paying attention to your body, and we'll see you in the next explainer.